The first treatment that we had available for MS came out in 1993, so not even 30 years ago, and since then we have over 10 different classes of medication, 20 different medications, made a ton of progress really in as far as tolerability, safety, and effectiveness. Classically, we've classified them as injectable medications, oral medications, and infusions, but increasingly we're sort of grouping them by how they're working, because each medication or each class of medications has a different way of affecting the prevention of MS worsening. There are medications that modulate the immune system but don't really suppress the immune system that much. There are medications that suppress the immune system a little bit more, and there are some medications that keep immune cells in the bloodstream. There are some medications that keep immune cells in the lymphoid tissues, in the lymph nodes, so that they don't come and attack the brain and the spinal cord, as happens with MS. There are some medications that deplete lymphocytes, which are a type of immune cell. So by depleting those immune cells, you're protecting the central nervous system. There are some medications that deplete only certain types of immune cells, and then there are some that are more broadly acting. Back in the day, 20 years ago, we only had a couple of different options. Nowadays, if a medication isn't working as well as we'd like, or a medication is causing side effects, or a medication isn't working with somebody's schedule or lifestyle, we have options, and we're able to switch and do that effectively. So 20 years ago, somebody with pretty severe MS would continue to have relapses or break through the medication options that we had available. Nowadays, even if I see somebody with a lot of relapses at the beginning, pretty severe ones, we can really make a change and alter the course of the condition, really put a stop to that worsening. It's very common and really normal to be worried when somebody gets a new diagnosis of MS. It's a shock. And the good news is that in the modern era, MS is highly treatable, highly controllable, and for a lot of people, the goal is to bring this into the background of their lives. And at the very beginning, obviously, it's in the foreground, but with effective therapy, it really is an attainable goal for a lot of people.